Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Now let us get into the treatment part, which everybody has been asking questions about. We have a number of patients coming from different sorts of countries and also people who are calling us, where they are not having a certain idea as to why they are using this hormonal pills, why are the reason that they are being given hormonal pills, and what are their side effects. Today we are going to discuss why these hormonal pills work for certain section of people and why their prolonged use is not good and what are their side effects. If you are someone who is suffering from moderate kind of fibroids, if their fibroids are very small and even if they are multiple, if their size is very small, then you need not have any sort of medication. That is what your gynecologist will say. But if you are there in certain size or certain moderate size, they can give you with GnRH medications. So how do these GnRH medications work? Remember I told you fibroids grow under estrogen, but if you are cutting this estrogen and certain section of fibroids grow under progesterone, if you are cutting this progesterone, what will happen? The fibroids will shrink. That is what this GnRH medications will do. They will help in shrinking the fibroids by creating a menopausal stage. What is menopausal stage? Very low levels of estrogen, very low levels of progesterone. Their levels as such are very low compared to your reproductive age. So what happens? There is menopausal stage occurring. But if you're someone who is planning for pregnancy, this cannot be used. If you're someone who is like very young, we cannot give this medication. If you're someone who is prone to this hot flushes or this hormonal disruption changes like mood swings, hormonal headache, weight gain and all, these can cause temporary menopause like symptoms. So by causing menopausal like symptoms, you will have shrinking in the fibroids. But remember, as soon as you stop this GnRH medication, the fibroid can again start growing. And also you cannot give this medication for a longer period of time, because by giving this medication for a longer period of time, you will have menopausal like symptoms without even developing menopause, which can lead into side effects like you can have bone fragility, that is you can easily break your bones, you can have hot flushes, you can have severe mood swings, you can have hair fall issues as well. And also this cannot be continued for a longer period of time, so they have to stop it at a certain limit. And after that they have to do a backup therapy which has estrogen and progesterone in them, and by that backup therapy the fibroid can reoccur again. And in whom should we not do this GnRH medication? We cannot do this GnRH medication in very young children or very young teenagers, and also people who are planning for pregnancy. So this is about GnRH medication, and what are the other options we'll view in the next slide. Now coming into the NSAIDs, which are non-steroidal anti-inflammatory drugs. So what happens in this non-steroidal anti-inflammatory drugs? They are especially to reduce pain. So if you're having fibroid, you will have this bearing down sensation as if something or someone is pulling down your uterus. You'll have severe pain during menstruation. So all of this, to counteract, they will be giving you NSAIDs. So if you are using NSAIDs for a very short period of time, that's okay. But fibroid is a chronic condition, right? So you have to be using this on a longer run. What happens if you are using NSAIDs on a longer run? There is no treatment for the pain. You're just becoming numb for the pain, okay? And what is the cause behind it? That is fibroid. So it is not doing anything to the fibroid, it is just a painkiller. And if you're using painkiller for a longer period of time, they will be telling you to take it along with the proton pump inhibitors like pantoprazole or rabdiprazole or esomeprazole, which can cause absorption problems, and also it can destroy the gut bacteria if you're using a lot of NSAIDs. So lot of gut dysbiosis can cause again estrogen dominance, leading into maintaining this fibroid because of usage of this NSAIDs. Next, coming into the very famous hormonal pills. Many people, if you're suffering from PCOD or if you're suffering from heavy bleeding or cysts, they will be giving you this hormonal pills. Everybody might have seen this hormonal pills. You have to take it every day at a certain period for a certain period of time. That is say 3 months or 6 months, whatever your gynecologist suggests. But remember, hormonal pills are synthetic in nature, first thing. Second thing, this hormonal pills I've already discussed, they contain majorly, either they are in combination with estrogen and progesterone, or they are only progesterone only pills. This progesterone can counteract the estrogen, that is why they are given, so that the fibroid will shrink. But in certain cases, if there is no proper counteraction, or this progesterone can also help the fibroid to grow. Instead of shrinking the fibroid can grow. And also if it is shrinking, as soon as you stop the hormonal pills, again it can reoccur. So the reoccurrence chances are also very high. Why are they giving it? So that there is counteraction between the estrogen and progesterone, right? As soon as this hormonal pills are stopped, you can have intermenstrual bleeding, that is bleeding in between or spotting in between your actual period. and also it can cause a lot of prolonged periods in certain section of people. It can not treat the condition but make it worse sometimes. Then why are we taking hormonal pills? What are the side effects of these hormonal pills? The side effects of these hormonal pills are weight gain. It can cause a lot of hair fall. It can cause a lot of mood swings. But in certain section of people, it is helpful if their bleeding is too much and it is unstoppable. And also the estrogen dominance is too much, then POP pills can have a lot of effect on the body to temporarily cut off that section where there is prolonged bleeding. So in certain section of people it can be helpful, but if you're using it for more than 2 months or 3 months, the side effects are sure, and also this is not the cure for your fibroids. Remember, as you stop it, again the fibroid will start to appear, and this can trigger fibroids elsewhere also. So please do take into consideration if you are using hormonal therapy. Now coming into the last one, which is tranexamic acid. Many people might have been using this. They tell me we are using some tablets which starts with T. We are not usually acquainted with the medication name. But remember, this tranexamic acid is usually to stop heavy bleeding. If you are someone who is losing a lot of blood, you don't have a lot of time, and you're not in a reachable place where we can contact you, or you can use certain medication, people will usually be giving you this tranexamic acid, where it will stop the bleeding in 2 to 3 days. But the problem with this is after you stop it, again it can reoccur, it can cause spotting, it can cause nausea, it can cause vomiting, and it cannot be used on a longer run. So that is the problem with the conventional form of treatment for fibroid problem. So if you're someone who is suffering from fibroids or having all of the symptoms that we have already told, and you're using this conventional form of treatment like most of our patients do and come to us, they ask us, see, we are using this for a longer period of time, we have the side effects of the medications, and also our problem is not properly solved. So they come to us with the hope that homeopathy will relieve it. Why are they hoping in this, and why are we having a success rate? We'll explain it to you. See, homeopathy is the safest form of medication. So there is no side effects. Even if you're treating the disease, there are no side effects attached to this medication. That is the first, best thing about homeopathy. And it is non-invasive. You don't have to put anything inside your body. There is fibroid shrinkage. There is shrinking of the fibroid. There is hormonal balance happening. There is estrogen dominance going down. There is progesterone and estrogen level being maintained, along with regulating of the menstrual cycle and preventing the recurrences without any side effects. What else do you want? See, we are having good number of cases which have good success rate in them, where the bleeding, where the menstrual problems are slowly going down, where the irregularities are slowly coming down, and also the fibroid size is shrinking. There is no reason for you to go for a hormonal change or a hormonal therapy for the side effects. They have certain side effects attached to it. Although the cause for giving them is good, the side effects are something which is very alarming, right? And also there is no cure for it in that area. So here we are offering you with cure, we are preventing your diseases, and also we are preventing so that it will not reoccur again. The medication will be given to you so that there is no reoccurrence also. So if you want to look for cure, if you want to look for an answer for your diseases, homeopathic treatment is the best option for fibroid. If you're someone who is suffering from hormonal disruption, or if you're suffering from fibroids, adenomyosis, endometriosis, or ovarian cyst, chocolate cyst, or PCOD, and you're looking for cure, Fidicus homeopathy is the answer. Here we have two types of consultation. One is online consultation and offline consultation. In the online consultation, we are having audio option and as well as video option. If you're someone who's staying nearby us, you can come and contact us in person. If you're someone who's staying far away from the nearest branch of Fidicus, you can contact us through online consultation. After the online consultation, we will be asking you for certain investigations regarding your symptoms, and if you have any sort of investigations already priorly done, you can share it with us. After the doctor consultation, especially to the online clients, our medication will be reaching your doorstep through courier. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. Across the globe, it can take 4 to 8 business days for our medicine to reach your doorstep. If you want to have a consultation, please do call us on this number, WhatsApp us, or message us through this number. If you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone suffering from fibroids, if you're seeing our video, remember that this video is done because of the lot of patient success rate that we're having, because we're doing this video for their queries itself. Many people are calling us just for for a lot of questions they have on fibroids, and then they're taking the appointments and then they're getting cured. So there is good success rate. So that is why if you're someone who's suffering from all of these diseases, especially female reproductive organ diseases, you have to choose Fidicus Homeopathy. Why should you choose Fidicus Homeopathy out of all the homeopathic doctors in the world? See, Fidicus Homeopathy stands for highest chance of health. Here we have three things. One is highest success rate, already curing things that are we are discussing here. Second is a transparent medication. There is no gray area between the patient and the doctor. Here we will be educating you on your prognosis. And the third thing, the personal care. The queries that you're doing or the queries that you're presenting, we are taking care of it and we are answering this through our videos, so that majority of the people who are not able to reach us out are seeing this video and they are getting answers for their questions. So the personal care at Fidicus Homeopathy is top notch. If you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.